Hello, my name is Aurika Savitskaite. I'm a co-founder of helmetbasedventilation.com. In this video, I will show you two hoods made by the company located in southern part of India, Phoenix Medical Systems. The hoods are Haven hoods. Here is the team of the developers, engineers who made not just the hood, but also other devices that can be used to fight the COVID pandemic. In this picture, you can see the training for the non-invasive ventilation or the CPAP hood in a hospital. This is the patient who is using the CPAP hood, non-invasive ventilation, and as I heard, we've been used for over 100 patients now in India. So here in my hands I have the simpler version of the hood. That's the one without the zipper. What I wanted to mention, it is very good quality, plastic, clear plastic. I don't feel any odor, any smell of glue or anything that can irritate the patient, because they may use it for a long period of time. So it is one piece, it is soft, there is no plastic ring. The neck collar material is different, it's very stretchy, easy to stretch, so the application should be not an issue. Also, the neck opening is offset to the back of the hood, so it will give more comfort for the patient when he or she is laying back in the bed, and also it will prevent leaks. Now, the neck sizing is very similar to the other hoods on the market. So it has the lines, and in their insert, you can count the lines and cut the line based on the measurements of your patient's neck. So, for example, this hood is a small size. If you will count the lines, you will know how many, what's the size for the neck it's gonna fit. So I will go to the next model, which is the hood with the zipper. So what is nice about the zipper? So the clinicians can access patients' face in seconds, and it's a big benefit. It will help the staff to provide faster, better care, and also the patient will feel less anxious when they know that there is a quick access if they need to have anything to be done. So this is the zipper, and as you can see, it is not easy to open or close because it's very tight, and it's tight to make sure that there is no air leaks. As you know, we wanted to minimize air leaks for many reasons. One of them, we wanted to provide a high quality, non-invasive positive pressure ventilation for the patient, and also we want to prevent from aerolization of the virus. In this case, I'm talking about the COVID patients. So this hood came in kit that included the inlet port, had a dead space, filter, venturi valve, oxygen tubing, and also the flow meter that you can use, and you just plug it in the wall. So that's a nice feature about this kit, that you don't have to go around and look for the supplies. You can just have everything in one place. And then the outlet port again has a dead space with the filter and PEEP valve. In a drinking port or patient access port, we have a one-way valve cap that easy fits in and out. Now, why do we use the dead space on the inlet and outlet ports? It's for the patient comfort again, because it will not press on the chest the filters or the PEEP valve when it's a little bit farther away, and it's flexible and soft. The underarm straps are connected to the helmet, and it has just a simple, you know, click on, click off connector. It's easy to adjust, and we know it is very important to adjust these underarm straps to prevent the air leaks around the neck area. Another great accessory is made by this company is the anti-asphyxiation valve. This is a separate part that can be attached to the patient access port. And when you inflate the helmet, you want to make sure that you pull the spring out so the helmet gets pressurized. In case there is an issue with the flow or the pressure, the valve will open and the patient will get ambient air. But the most important thing is to make sure that patient gets his or her non-invasive positive pressure ventilation treatment. So you want to fix the issue fast to make sure that therapy is delivered appropriately. Also in the kit we had the flow meter. So it's nice that everything is in one piece. Also the Venturi valve, and it has some directions, you know, what the flow should be to reach certain amount of FiO2 that patient will require. Again, the earplugs. Some patient will use it, some won't. As you can see in this setting, we have antibacterial, antiviral filters on both ends, inlet and outlet. So the inlet with the filter will reduce the noise in the helmet. Again, it will depend on how high the flow is, but the filter here will work as a muffler. And the filter on the outlet side will filter out the virus or bacteria, so it will reduce the spread of the virus in the environment. All right, so I'm going to put the helmet on now. All right, so I have an airflow here, so I'm going to just disconnect the inlet port and connect my airflow here. Okay, you want to make sure that you connect your flow, you connect your outlet, you have a cap on your patient access port so there will be no leaks on this side. You set your PEEP as desired, so I'm going to put it in the lowest PEEP right now for myself. And you want to make sure before putting the helmet on the patient that the helmet has no leaks. So I'm closing now the zipper. I'm holding here. I'm going to close the neck seal, and you can see how it inflates. And it's pressurized, so I don't see any leaks in the helmet itself. Now open and close the zipper a couple times to make sure that it works well. And before putting on the patient, you want to make sure the zipper is open. Okay, your underarm straps are open here. You want to have 2 clinicians to put the helmet on a patient. They have to stretch that from sides. I'm just going to do that myself. And again, this neck seal is really soft. All right, so it is definitely my size helmet. You want to make sure you get out all the hair because it feels very nice and snug around my neck. It doesn't press at all. So you see, I can put my fingers easily here. I can already feel the flow in my face, so it's kind of refreshing. when everything is ready, you can already clip your underarm straps, and if you need more cushion for your underarms, you can use like a rolled towel or other soft material to make sure that the patient doesn't get skin irritations or skin breakdown. Okay, so clip on. And now, when everything is ready, when the patient is ready, we can close the zipper. Just hold it here on one side. And the moment the zipper is closed, all the way, you want to make sure it's closed all the way so there is no leak. You can see how the helmet gets pressurized in seconds. Then you can adjust your underarm straps. There is no leak around the neck. The neck seal is very, again, nice and soft. I can lay back. It doesn't bother me in the back at all. So the patient access port, easy to remove, easy to put it back on. So here I'm going to use that anti-asphyxiation valve. And as I told you, my helmet is not pressurizing right now because I didn't pull the spring out. So I'm going to pull the spring out and it gets pressurized. You see there's no air leak here. In case I'm going to lose the airflow, this anti-asphyxiation valve will open. It feels, again, very comfortable here. I don't smell any glue or any, plastic or anything that can bother the patient. It's a nice helmet, and I'm gonna take it off now. So I just opened the anti-asphyxiation valve. As you can see, the zipper is very convenient. I can open it in seconds, even by myself. So even if the patient will feel uncomfortable in the helmet or feel anxious, he knows that he can or she can open the zipper right away. So I'm gonna take this off. I want to say thank you to Phoenix Medical Systems for creating Havenhood and other accessories that can be used for non-invasive positive pressure ventilation. Also, I'm happy to hear that a lot of patients are using the helmet-based ventilation in India. So I want to wish you a lot of luck and more inventions to fight this pandemic. Thank you.